Well, the time is just gone 16 minutes past 9 as we continue with the second half of this morning's edition of News and Views right here on Salam Media. If you have just tuned in, we welcome you. I am Inayat Wadi. I'll be with you right until 10 a.m. And what you can expect is in the next 45 minutes is to take a look at the first case of a new COVID-19 subvariant has now been confirmed in Gauteng. The question is, should we be concerned in this country? And also taking a look at a book review this morning. Now, this is quite interesting because this is a story of Ibrahim alayhi salam, which is a children's book with Azima Mohammed. Now, she is a charity partner of Penny Appeal South Africa and also an author of children's books. So we will be linking up with Azima at around 9:35, and towards the end of the broadcast, focusing on Women's Month, women in the media, with Salam Media. And this morning, we will be featuring a presenter, MC, producer, and author Mariam Mkwanda. So all of that still to come on the show right until 10 a.m. Stay with us. But right now, we're going across to be joined by senior research scientist at the Center for Lung Infection and Immunity, UCT Lung Institute, Dr. Shaheem Jamdullay. Dr. Shaheem, Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome.
Walaikum salam and good morning and salam alaikum to all the viewers and listeners on online.
Yes,
Thank you for
wonderful
having me.
that you're able to join us now. I think just before we get to this subvariant, it is clear that there are still many people that are affected or impacted or still suffering from the effects of COVID-19, and we see that all the time. People still talk to us; they haven't fully recovered, and when we have variants of this and subvariants like the latest one, the EG5. That is now we've seen the first case in Gauteng. Just where are we as far as COVID is concerned? And these subvariants, are they going to become the norm going forward?
Yes, I think you've summarized everything that is of importance that people need to know. The short answer to whether we should be worried about an increase in illness, hospitalization, and death with the circulation now of this new subvariant in South Africa is a short answer, no. And the reason behind this is because this subvariant comes from the lineage of Omicron that we have been accustomed to since the end of 2021. And as everybody knows, with the circulation and emergence of that variant, Omicron, and all the subsequent subvariant descending from it that have been in circulation in South Africa, we have not experienced any form of increase in hospitalization and death. So, no, we should not be worried. But as you mentioned, there are still people who are vulnerable, and we can touch more on that around who should be more protected and what are the different levels of protection that we have for these people.
Exactly, and I think obviously we've seen the news come out, and we've seen even the World Health Organization saying that we shouldn't be overly concerned about this subvariant. But again, coming back to the people, particularly those who had actually suffered the effects of COVID-19, and those that haven't fully recovered, clearly there is still a lot of areas of concern, and purely from a protection perspective. And I'm sure that a lot of work is taking place in the background scientifically as well with people like yourselves that still tracking the impact and the consequences and the effect of the COVID-19 virus.
Correct, yes. So in many hospitals, especially the bigger hospital like a Groote Hospital where I'm myself based, Baragwanath, and many others in the country, there are clinics within the respiratory diagnostic and follow-up diagnostic unit for respiratory diseases where we have what we call long COVID clinics, where we're still seeing people who are coming through with respiratory sequelae and problem that develop during the acute phase of the infection with the virus. And there are other types of problems like cardiac issues, renal issues that people are still experiencing in the long term following an infection that may have happened 2 years ago, a year ago. And these are mostly people who are either in their elderly age, so people who are around 60 and 65 and older, and people who have underlying issues that we know now, such as diabetes, hypertension, your cardiovascular diseases, and the likes. So these are people who we see mostly still reporting to our clinic with some form of sequelae and long-term effect of the infection. Many of them have not been able to fully go back to activities that they used to do on a daily basis before their infection. But Alhamdulillah, we are getting more and more accustomed and getting more knowledge around how to actually help these people to transition back into a state that they had prior to the infection.
Yes. Also, doctor, from a system point of view, how strong or how robust is our systems? From a surveillance perspective, to actually track the virus and any other impact, like for instance, variants, new variants that may arise, or subvariants that may arise from time to time.
I can tell you with a lot of confidence that in South Africa, we have an extremely good system in place. And I would like to remind people listening and watching right now that South Africa was the country that actually reported two of the variants that had emerged, which are the beta and the Omicron, which exemplifies that we have a very good system in place. And ever since COVID has moved from pandemic status to endemic meaning that it is now something that we should consider to have to be normal around us. It's always going to be there in the background. We have continuously been sequencing the different variant and subvariant that have been in circulation, and this is actually being done at national level. And I think not just South Africa, but globally, most countries who have the capacity to actually do this type of what we call sentinel surveillance program have continuously tracked and monitored the different form of evolution that's happening with the virus that first emerged at the early stages of 2020. But also to finish on that aspect, I think what we've learned and the most important lesson that we have taken from this big pandemic that has affected life around the world is that we now need to have a better tracking system for not only COVID-19 and the virus that has emerged and caused the problem, but also any future viruses or bacteria that could come in circulation. I mean, this is the third coronavirus that has caused some form of disturbance around the world. And we know from the lack of response or proper response in areas where these transmission from the natural host, which is the animal to human, nothing has changed there. The wet market in Southeast Asia is still ongoing. The habits of people deforesting and getting closer to these natural hosts, this animal has not changed. So we know for a fact that there will be incidences and episodes of future pandemic, and the surveillance program that has emerged and that has been strengthened after COVID-19 is still in place, not only for COVID-19, but also for any future pandemic that may arise.
Yes, and it is obvious that when the pandemic had actually hit, very little was actually known, and a lot of was in work in progress. But we've also learned, doctor, that the virus has not disappeared entirely. But what we know is we've seen vaccines come through. We've seen the success of vaccines. We've seen things like social management of the virus, and all of that has basically minimized the impact of the virus, but it still hasn't entirely disappeared. And this is an area that I suppose that people still need to be aware of. That since it hasn't disappeared, we still need to take precautions.
Absolutely. And again, a reminder to everybody that the vaccine is actually a vaccine that is there to protect us against developing very severe diseases and death. And it is not a vaccine that prevents the infection, which is why in some instances we still have a continuous circulation and evolution and mutation of this virus that stays in a cyclical form, moving from country to country after it has mutated to give rise to new subvariant. I mean, it is not like, a disease like polio where we have a vaccine that is effective against the transmission. It's important that people realize that it will still be around. It can be compared to flu right now, but we should also be aware. I am a scientist, but I'm not going to be. It's not this reason that for this reason that I will be pushing for the vaccine narrative and forcing or encouraging people to massively vaccinate. I think we also need to be real with the situation right now. We've Most people around the world having been at least infected once with any of the previous variant or subvariant of Omicron that have circulated. I think it is safe to say that everybody has some form of natural immunity against that virus and against future infection. But where it is important to highlight the need for possibly, a boost with a vaccine right now would be in people who are vulnerable still to developing this severe disease. As I mentioned, these are people who are older. These are people who have underlying medical condition that can make, the disease more severe if they get infected. We talk about a decrease in hospitalization and death, but we should also remember that even with this current subvariant Erin or EG.5 that will be in broader circulation in South Africa right now, it will still cause disease. It will still afflict you to the point where you may not be able to go to work, may not be able to go to school. And it remains the responsibility of everybody to protect themselves. So I'm not going to talk about the wearing of masks by everybody again, but it is more of a targeted type of tactics right now, whereby if somebody has started developing any form of flu symptom, if that person is going to move around, he or she needs to wear a mask. And if the person has actually flu symptom, the person needs to make sure that he or she does not attend any form of meeting in congregate setting, be it prayers, be it for social reasons like wedding or funerals, or any other form of event where there will be a lot of people joining.
Yes, obviously the risk of transmission is very low from what we've read with regard to the subvariant, but also coming out of the winter month in South Africa, and which is known as the flu season. And you mentioned that these are all flu-like symptoms, things like coughing, fever, shortness of breath, tiredness, body aches. All of that are obviously symptoms of flu as well. Even things like runny noses, sneezing, all of that. So at the end of the day, we don't know at the end of the day whether it's just a flu or is it the subvariant. But again, I suppose people that are most vulnerable still need to take precautions, particularly those that have underlying conditions, the elderly, and those that have, certain conditions that recur all the time.
Absolutely, and I think the need for people and the need that they feel to test right now when they have respiratory conditions has dropped down considerably. It's not like in the early stages of the pandemic where everybody was worried because there was not a lot of information, because it came with a higher level of hospitalization and death. Whichever microbe, whether it's a virus like flu or COVID or a bacterium that may have infected you to cause these symptoms, you need to take your precaution. You need to stay away from these people, like you mentioned, brother, who are older, who have any underlying condition like hypertension, diabetes, cardiovascular diseases, renal diseases. And right now we have reached a stage where the influenza virus that you mentioned that has been in circulation during our winter month, kills more people than COVID-19 is actually killing. I mean, in South Africa, yearly, we have around 6,000 to 10,000 people who die. 50% of these people are people who are classified as elderly, so they are around 65 years old and older. Around 30% of them are people with what we call immunocompromised condition, where the immune system is not as effective as other people who may not have conditions that they have, like HIV. And then you also have a certain proportion of women who are pregnant and people with other underlying issues who will develop severe disease from the influenza infection. So, as a matter of fact, people who are prone to developing these types of severe disease when infected with flu are the same people who need to be careful about getting infected with COVID, because it will cause and it may lead to similar conditions.
Well, Dr. Shem Jamdullay, I must say Jazakallah to you. Shukran for your time with us this morning, for unpacking and obviously keeping us informed with regard to the latest subvariant as well. So all the best to you, and we thank you for your time once again.
Afwan.
Assalamu alaikum
Shukran,
wa rahmatullahi wa barakatuh.
wa alaikum salam.
Yes, that is Senior Research Scientist, Center for Lung Infection and Immunity, UCT Lung Institute, Dr. Shaheem Jamdullay, with us this morning, just providing us with an update on this latest COVID-19 subvariant. We're going to go for a break. We come back. A lot more to unpack right here on Salam Media until 10 a.m. this morning.